What kind of wickedness is this? A woman has been arrested in Douala 5 for opening a clinic or a hospital in her living room. A very dirty living room with expiring drugs that expired since 2021, 2 years ago, and there were patients in her hospital, in her living room, receiving treatment from what? From those expiring drugs. And still in Douala 5, the senior divisional officer and the laws and the security officer arrested a man in which a baby was found wrapped in a plastic bag, killed already, and dumped somewhere within the clinic or the hospital. What kind of wickedness is this? How much money is enough? What are we doing this to our civilians, to our brothers and sisters? If you know you are not a doctor, if you know deep in your conscience that you are not a doctor, even with a register, a hospital, close it down. Or look for somebody who is more qualified and recruit the person there and stay behind as a businessman. If you know deep in you that you are not a qualified nurse or doctor, you are not qualified to say anything like medication, stop it today. Change your mentality positively, because you are killing and killing thousands of Cameroonians every blessed day in the name of you are making money.
His report.
From the first look, one will think it is a sitting room for a family, but this sitting room has been transformed into a clinic by the owner, who even admits patients inside. It was one of the discoveries made by the divisional officer of Douala 5 subdivision during an operation he launched.
The objective today was to close down health centers that function in illegality. People get up, transform their bedrooms into the health centers, to administer expired drugs, expired injections. This is what kills the population. You cannot on your own create your health center. You don't respect any norms, and you expect us administrative authorities charged with protecting lives to accompany and clap for you.
Upon the discovery of this health unit, a cupboard containing drugs will be taken outside, and surprisingly, almost all medicines found inside are already expired since 2021. The accused says she is not guilty. From the sitting room clinic, the next stopover of the convoy will be at Sodikombo, where the team stumbled on a fetus which has been wrapped in a wrappon and dumped. The doctor of the clinic says he only saved the woman and didn't do any abortion.
They came here, it was about 3 days ago. So we did ecography. The child was already dead in the womb. So now we're just struggling to remove the child. And everything comes out as the ecography to us that the child is already dead. The child was almost in the state of decomposition.
The divisional officer says the operation will not end just now.
The operation today is an operation that will continue. We have closed a good number of them. We have arrested some promoters where the situation was exaggerated. You cannot work as a health center, even basic toilets, basic hygiene rules are not respected.
During the crackdown on illegal medical centers, the team went through some medical centers, and the state in which they were found was disappointing. The divisional officer sent this message.
All promoters of such illegal institutions to close them down immediately and change activity, because we will continue to fish them out until there is total order in this domain.
In the course of the operation, 5 people running health centers without authorization were arrested, while 15 health centers were shut down.
Those who have been arrested, investigations will be opened and they will be presented to the State Council for prosecution. They merit it, and that is exactly what we are going to do, because you cannot be caught administering expired drugs and we allow you to go scot-free.
Day 1 of the operation took place within Dembange, Deido and Cité de Palmier health districts. Dr. Asongwe Kleto says they have 300 illegal health centers to close, which implies the operation is far from ending.
4 months ago, I sent out a video calling on the government of Cameroon to close down all the so-called clinic or private hospital dotted all around our quarters in Cameroon, especially in city like Douala, Yaoundé, Bamenda, Buea, and many other regional headquarters. I told you people in that video that all these so-called clinic and roadside drugs are killing Cameroonians more than any other kind of disease or even the Anglophone crisis. Thousands and millions of Cameroonians are going into their early grave, killed by so-called doctors or killed by those working in so-called clinic in Cameroon or hospital or private hospital. And then the government of Cameroon during that period came out and said that what? That there are more than 3,000 clandestine hospitals in Cameroon. And recently we heard what happened in Douala 5, where the senior divisional officer went out and closed down 15 private hospitals that are illegal. And one of it is what I'm talking about today, where they caught a woman in her own parlor, having a hospital in her house, in her apartment, using her parlor, her living room as a hospital. And the shocking news there is that what? They went into where she is keeping her drugs, like a pharmacy, and then they open it and check all the drugs there, starting from paracetamol to whatsoever he is treating or she is giving to patient in that particular hospital has expired since 2021. And people were there. Patients were in that living room receiving treatment and taking those medications. Just imagine what this medication would do to their bodies, the kind of illnesses that this medication will cause. And today we are asking, where are all these kind of terrible illnesses coming from? Like cancer, hepatitis, and many other kind of diseases that you cannot explain. People are dying every day, and we in Cameroon keep on saying it is witchcraft. These are the things killing Cameroonians. And if you do not take responsibility, you are going to die very early. This unqualified money monger in Cameroon opening a clinic everywhere and taking advantage of the corruption in Cameroon to kill Cameroonians. You have the power to live and the right to live. If you decided or say that you are going to be killed by these unprofessional doctors and nurses, this power money monger in Cameroon calling themselves doctors, dotted all around our quarters, then you are the one to be blamed. Because I keep on telling you, do not buy any drugs by the roadside. Even in the pharmacies in Cameroon, when you buy something there, make sure you check 2 or 3 different places for confirmation before you take it. Because many of them are unprofessional and they will give you prescriptions that are not right. A woman without any conscience open a clinic in her own living room and using medication that are expired 2 years ago, 2021, giving it to people consciously without any guilty, without any pity, without thinking of the consequences, the harm that those expiring drugs can cause to these people. It is terrible. Cameroonians, we need to change our mentality. We need to change our mentality. It is not all about money. I keep on asking this particular question. How much money is enough? That you will decide, that you know that truly in your conscience, you know that you are not a doctor. You know that you are not a qualified doctor. You know that you are not a nurse. You know that you are not qualified to open a clinic. You know that you are not qualified to open a hospital. You know that you are not qualified to be selling drugs. Yet you are doing it because you want money. You are selling expiring drugs because you want money. God alone in heaven will judge you. God alone in heaven will judge you because you are taking advantage of the ignorance of many Cameroonians. You are taking advantage of the corruption in Cameroon. And we will stand for the innocent. the uneducated, the people you are taking advantage of. It is terrible, and we have to put a full stop to this. We keep on, and the government will listen to the senior divisional officer for Douala 5, telling us that there are more than 300 unauthorized hospital or clinic or medical center in Douala 5 alone. And then he went out one day and closed down 15. And then the next day I was expecting that he would not sleep after seeing a hospital in a living room with expiring drop. But they did not go out the next day up to today. They are sitting and waiting, because when they make like this and shake it, the other people will run in to register their this thing without the government seeing. What are they registering? They have tabled a document that they want to open a hospital for it to be authorized, but you have not seen it. You just sign in your office, take the money that they are giving you. I blame the government also, because the government have allowed healthcare system in Cameroon in the hands of businessmen. Anybody that can afford to open a clinic, anybody that have the heart, the wicked heart, to open a clinic and do it without any. Cameroon is a small country compared to other countries like China, where they check all such things. Compared to United States of America with 300 and something million people, 300 and something million people. Cameroon of 27 million, you cannot check. They have divided Cameroon in calling it decentralization, giving authority to people in any little corner. But yet, those people in those little corners are so much interested in what they are receiving as bribe. And they remain quiet. And Cameroonians are dying every blessed day and going into their early grave. It is terrible. I'm calling on you to change your mentality positively. I'm calling on you, the innocent one. Do not allow these unqualified nurses and doctors to kill you. It is preferable for you to cry on social media so that we can help you to go to a better hospital than for you to say you do not have money and you go and allow yourself in the hands of wicked, evil nurses and doctors dotted all around Cameroon. Do not be ashamed and allow yourself to be killed by this unprofessional money monger called doctors and nurses, dotted all around our quarter. Do not buy drugs by the roadside. Do not go to clinic or any hospital within the quarter. Those people are not trained. The only training they have received is to cause abortion. The only training they have received is to kill you. The only training they have received is to make money through from medical health, from healthcare system. We saw another video still in that Douala fight, where they went into a hospital and they saw a small baby that they have killed and tied in a wrapper. By who? By the doctors. And the doctor stand there and say he only helped the woman who was already having problems. Why then tie the future or the baby in a wrapper and dump somewhere? These are human beings we are dealing with. Cameroonians, I'm pleading with you. If you are operating such hospital, illegal hospital, or if the hospital is legalized and truly you know within you that you are not a doctor, you know within you that you are not a medical professional, you know within you that what you are doing there is not professional, or you have been killing people, or you have been administering wrong prescription to people, today, change your mentality positively. Change your mentality positively and close down that place. Do not wait for the government. Close it down. If you cannot close it down, you resign from there and look for professional or trained medical doctor to take over from you if it is your business. Do not stand there. Do not be there. If you check your drops every blessed day, do it so as to take away all the expiring one. Do not buy drops along the street to come and sell in your own clinic. You go to Marché de Pont in Douala. That is where they are selling. And the police are every day saying that they are searching for those selling roadside drugs, knowing fully that there is a market authorized by the government of Cameroon. and Marché de Pont, and many other places is selling expiring drugs. And people are going there buying. People, hospitals are buying from there. And the drugs that the government has sent into hospital, nobody, those working at the pharmacies are not selling that. They are selling their own. They are selling their own. Cameroon, what have we done? The government of Cameroon, what have we done? Businessmen in Cameroon, what have we done? What are you taking advantage of our ignorance? Why do you refuse to teach us, to train us, just because you want to take advantage of our ignorance? Why? It is terrible. And we will not stop crying. We will keep on crying. And one day, God in heaven will hear our cry. And He will rescue us. Thanks for watching. May God bless you.